Hello, everyone. My name is Ginger Christ, and I'm a reporter with Modern Healthcare. I'd like to welcome you to our panel today, answering the unconventional innovation call. With business models and production plans overhauled by the extreme need for healthcare PPE, medical device companies and supply chain professionals found themselves calling for innovative solutions from some unconventional enterprises. Industries like toy and auto were quick to pivot to manufacturing efforts and answering the siren call. With this panel, understand the mental and physical changes enacted by these executive humanitarians to bring safe, effective supplies to those on the front line. Now, let me introduce our panel. We have Susan Brennan, who is the COO of Bloom Energy, who brings more than 24 years of manufacturing experience, including automotive, vehicle, powertrain, and components assembly. Michelle Nadeau leads the marketing and creative departments for Timbuk2, a messenger bag manufacturer based in San Francisco. Simrit Sandhu is the Chief Supply Chain and Support Services Officer at the Cleveland Clinic, our host today. In this role, Simrit leads a multidisciplinary team that spans sourcing, procurement, materials management, analytics, and patient support services. And we have Eric Walli, the Division Manager of Regional Planning for American Honda Motor Inc., with responsibility for long-term strategy development for Honda's regional companies covering automotive, power sports, and power equipment businesses. As I said, thank you for joining us, and we will get into the panel now so we can hear from the panelists instead of just me. So our first question is, how did your company respond to the medical industry's need during COVID-19, and who did you work with? I'm going to kick this one over to Eric first.
Thank you, Ginger. Thank you also for the opportunity to be here. This is kind of a different space for Honda. Hopefully everybody's familiar with Honda. We make a lot of different products. Hopefully you're familiar with some of them, maybe even own or use some of them. But in the medical space, this is quite different for us. But our company philosophy is to be a company society wants to exist. So it was a very easy decision for us to move into this space once we recognized there was a need. And we did a handful of things. We did a few very quickly. We started donating our personal protective equipment, and we started printing 3D mask components. But we recognized that we needed to do more than that. And we had four main initiatives that kind of took us out into this space. We ended up going through stopthespread.org, a federal program that matched manufacturers with other manufacturers in the medical supply space that needed help. We ended up making a small compressor for a company that supplied that compressor to a ventilator maker. That was one very compelling thing that we did. We also started to produce our own complete unit face shields, which was really interesting work for us. Some parts of it were familiar, but many parts of it were not. So that was a second thing. We converted some of our Odyssey minivans and made them kind of COVID patient and healthcare worker transport units. And they're actually still driving around the city of Detroit right now. So that was a really interesting and great thing. And the fourth kind of main thing that we were able to do is make hand sanitizer. We repurposed one of our manufacturing facilities to make over 5,000 gallons of hand sanitizer and donated much of that in the states of Ohio and Michigan. So pretty broad response, and definitely took us in places that we had never experienced before.
Thanks so much, Eric. I think we can say the same for many of the other manufacturers here. Let's hear from some of them too. Michelle, what happened at your business?
Yeah. Hi, Ginger. Thanks again for inviting us. Timbuk2 is very proud to even participate on a panel with such esteemed group of people. And so, as Eric mentioned, a little bit of background on the company itself. Timbuk2 has been around for about 30 years. We're a messenger bag manufacturer and backpack manufacturer in San Francisco. And what was so unique for us as a retail brand, when the shelter in place hit, we immediately shut down all of our operations, everything from our retail stores to our headquarters to also our San Francisco factory. We were able to shift our factory into that normally makes lifetime warranty bags. We're able to shift that into a mask production facility. So we actually worked with the governor, with the mayor of San Francisco, and we're able to reopen as an essential business. What was so complicated and confusing during all of this was not only everything, but for us, we build bags with Cordura, which for anybody in the material space, it's a really durable, hard fabric that allows for us to have lifetime warranty bags. And you can't breathe through them. So when we decided that we were going to start making non-medical face coverings, we actually had to reach out and get some help. So we worked with a whole myriad of groups. Our friends at UCSF were able to consult with us on how to actually make a mask. If we all remember back in early March, it wasn't as easy it is now to just say, here's the pattern, go ahead and make it on your own. So we did consult with UCSF and their medical team. We worked with NBC Sports Bay Area and all of the local professional sporting teams who all donated t-shirts to us so that we could actually make masks out of them. So it was really all hands on deck for us at Timbuktu. And we got about 60,000 face coverings out to the San Francisco community.
Thank you. I know when everyone was coming out with the models for how to, or the patterns for how to make masks, I was sitting here wondering, like, which friends do I have who can help me, because I cannot sew. So also thankful for that work on the personal level.
Right.
Susan, can you tell us what's going on, or what went on at Bloom?
Yes, thank you, Ginger, and also thank you for inviting Bloom Energy to this panel. So Bloom, we have a little bit different story in that today the product we produce, and for those people that aren't familiar with it, is just we make distributed power. So we make energy, we make electricity. And we are actually an essential business, and we support hospitals today or pre-COVID, as well as labs that are working on COVID testing and treatment. So when the opportunity came for Bloom to say, we do this today, how can we contribute? The governor of California called our CEO, KR Sridhar, and asked, what can you do? And can you repair ventilators? And we knew we weren't going to be like some of the other companies and actually make them, but we knew from what we do to today, the design we have, the technical competence we have on our team, that repairing ventilators was in the art of the possible. So it took us 3 or 4 days to get organized. And remember, as an essential business, we continued operating to support hospitals and data centers and grocery stores. So we took a very small team of existing employees and carved out a small part of our production facility in the Bay Area, and received our first set of ventilators from the state of California. And we had a great relationship. It was a really great partnership between the state of California, the Office of Emergency Services, OES, Bloom, local hospitals in the Bay Area, because we are not we're not a healthcare business. So we wanted to make sure that we, just like we do with our servers, that we follow all the quality processes and protocols, and that everything that we do, if we are going to provide these ventilators back to healthcare providers, that they are in the proper, that they are usable. So we partnered with local hospitals to help us with that. They then connected us with the people that actually come into their hospitals and certify their ventilators. So the people who certify ventilators co-located with us in our factory in California. So it was really a great, going from being essential service to being able to refurbish ventilators very early in the pandemic when they weren't available, and get them immediately available to people who need them. And then we continue to challenge ourselves, and we are now rapidly deploying microgrids to, whether it's pop-up hospitals that we did with the Sleep Train Arena in Sacramento, or we partnered with the local hospital in the Bay Area that was doing a COVID field hospital. And rather than have diesel generators, that one of the things I'm most proud of, and there's many things I'm proud of with Bloom, but we don't have particulates. There's no combustion. And when we create electricity, so you're able to actually land a Bloom server right next to a field hospital, power that hospital quickly, and get people into the healthcare professional space where they need to be to get better.
Thank you. I was hoping you'd bring up the microgrids. I remember first reading about those kind of earlier on in the pandemic. And I thought it was just such an interesting technology to make some of these field hospitals possible. So thanks for sharing that.
Yeah,
I'm going to turn it over to Simrit now. So maybe she can offer a little bit different perspective here, and coming from the side of the clinic and a hospital that, was dealing with manufacturers or working with manufacturers who were pivoting to try to help the healthcare industry. when, the global supply chain just could not support this immense need on the, worldwide scale. So do you want to help give us some insight on how this all played out?
Thank you so much for the opportunity to talk about it from a provider perspective. And thank you to all the other panelists who showed us how we could reimagine and reinvent ourselves to not just survive, but thrive. So thank you to all of you. And you represent probably many such partners we found both locally, nationally, and globally that came to our help. But from our perspective, in a world where there was nothing left to buy, we had to reinvent ourselves. And we became a party that was no longer RFPing or gathering requirements. We were speccing product. We were using your sourcing organizations to find global product. We were beginning to make a very opaque global supply chain into something more transparent that we could see. We began to understand the arbitrage between raw material, labor, finished goods, robotic automation, things that you live, but we had to understand to make sustainability possible. So I think it was a growing moment for us to meet you halfway and begin to understand how do both parties reimagine ourselves. How do we bring to bear our strengths, our practicing physicians, our ability to design product, our ability to disinfect, our ability to create demand planning and more transparency, and be a better communicator and partner to you so that we could solve for this together. So interesting times and a need to reimagine and reinvent all ourselves.
Thank you. And kind of just, building off that, I'm interested in, what was it that made some of these partnerships work and maybe some of these partnerships not work? So, what were some of the struggles? What kind of, made this all possible? I'm going to send this one over to Michelle to start.
Great. Yeah, for us, honestly, we couldn't have done much of what we did without those key partnerships. Kind of like I mentioned, it took a very interesting group of people to come together to create our shift from messengers to masks for Timbuktu. And really what was so important from the very beginning with these partnerships was clearly articulating what we knew how to do, what we didn't know how to do, and what we could do and what we couldn't do. And I think as business people, we're always looking for the silver lining, and we're always promising, and we can always do so many things. And a lot of times we often deliver on that. But because it was so critical and, we still didn't know what we didn't know. And we learned a ton, and we couldn't have done it without the partners. And I think just a level of vulnerability and honesty right out of the gate was really key to the success of partnerships with us.
Okay, thank you. Susan, do you want to add anything to that? Was your experience similar?
So I think similar to Michelle, but I think what is really important, and I think all of us probably felt it, is a common mission. We all had a common mission. So in our case, it was, if we bring these ventilators in, how do we have the same cycle time that you have in a production facility? And instead of a dealership or a hospital or a grocery store waiting for this, there's a human being laying in a hospital waiting for this ventilator. And so the team members that came together inside of Bloom, we all said, okay, we understand that this is a 24/7 operation. There are real life, and unlike in healthcare, this happens. I think I'm not a healthcare professional, but every day. So we adopted that healthcare mission, or what we believed that was the healthcare mission, that there's a human being on the other end of this decision, on this delivery. So we need to get it done, and we need to take every skill we have, all the lean skills, all the competencies that we have, engineering, logistics, get these in and get these out and get them to people who need them. And when I think our proudest moment was when the hospital ship Mercy came into LA and the ventilators had not been prepared. And so they went to the LA hospital, and the providers couldn't use them. And we got them in our facility and turned around in less than 24 hours. And I mean, that was a partnership. That's the state of California. That's a hospital, people we don't even know. We're talking to people on the phone that we've never met, maybe never will meet, we had to airlift them. It was a major undertaking in less than 24 hours with just a really committed group of people. So I found that we actually didn't have any challenges. Everybody was so focused on on getting this done and getting it done in a way that we were going to support people who were truly in need.
Great, thank you. I know I definitely think we've seen that, partners coming together. I mean, as evidenced here today, partners coming together that you never expected. Eric, so what would you say? Were there any roadblocks for you, or were things, smooth sailing?
So maybe not smooth sailing, but I wouldn't call them roadblocks either. I think what Susan was describing about a common mission, we felt that very much as well. And the partnerships were like a key component of each of the responses that we made, but I'll share a little bit about the compressor manufacturer that we worked with. And I think Simrit was saying that, the medical community met us halfway. I have to be honest. I think the medical community came more than halfway to meet us on this. The component that we helped this very small company build was very specific, very different than anything that we've ever made before. So it was a batch process style component, many small intricate parts. Not that we didn't understand it, but we just didn't have experience in making something like that. So we had to work very closely, long hours, but there was never a roadblock. We were both really committed to making the volumes really escalate quickly, knowing that the need in the marketplace was there. I mean, it was as rapid as we could make it. So my reflection on that relationship, which is now, kind of at the tail end of that, is it was fantastic and meaningful. And I think we probably both learned something along the way. So, at the end, I felt like we were able to make a big difference. 30,000 plus compressor components we were able to put in the marketplace. So no small feat. And clearly that was a product of a very tight relationship with this manufacturer named Dynaflow, by the way. I should give them some credit. And I want to thank stopthespread.org, who was so instrumental in making that connection for us kind of through the federal program.
Great, thank you. I know there were a lot of different programs through the government, through healthcare agencies, and associations that were just really trying to connect partners that wouldn't have been able to find each other on their own. So it was interesting to see how those partners kind of connected, and maybe to see how they'll, stay connected in the future. Simrit, I'm kind of interested in knowing, sometimes, or not sometimes, most of the time, things can move slowly in medicine. I mean, there are a lot of safeguards you have to take. There are a lot of precautions. So how did you, how difficult was it to work with, new partners so quickly and to try to, ensure safety at the same time?
We're very fortunate at the Cleveland Clinic. The culture is one of teams, but we have a lot of great teams. Our innovations team hosting this wonderful event came as a tremendous partner and helped us do things such as iteratively design, prototype, and decide what solutions could scale or not. And I think that became a very, very crucial part of the solution. To get speed, we had to ensure that we were thinking for scale and sustainability and not heroics. And that mindset probably lined us up for success. We were able to partner very carefully and closely, to Eric's point, to ensure that we prototype and spec the product appropriately. We understood our responsibility in that process, and we looked for an ecosystem of partners. So everybody in our team, everyone from philanthropy, our donors, our board, our practicing physicians, our disinfection arm, we're looking to see what can we do to come together to scale a solution? How do we sustain the solution? Not just build something and walk away, but sustain it for a pandemic. And I think that approach of truly coming together and being tied so closely to the mission at the end, these were our patients, these were our caregivers, these were family and friends that were walking in every day, putting themselves at risk for the benefit of the larger good. And nothing fuels and sustains the energy like that does.
Definitely. We know that a lot of teams have been putting in multiple hours. And as you all said, kind of working toward this same mission. We've definitely seen that. I'm kind of, Simrit, I'm going to let you maybe just continue here. And I want to know, how were you able to, I know you said that you already work in those teams and you already have strong teams. but how was your team able to actually make those things happen? Like, what had to change on the back end to make these things possible?
Susan had actually referenced it, and she put it best. Instead of making this more of a standalone effort, we put together what I would call a mechanism or a body that brought in individuals from different parts of the organization. So we put together individuals from innovation, from philanthropy, from our disinfection arm, practicing medicine, a lot of analytics arms that began demand planning and forecasting. We recognized that these skill sets had to be put into what we were calling a buy, make, disinfect, donate, manage utilization, tool set that could begin to look at the situation from all angles. And I think putting that particular structure in place was paramount. It helped us become better partners to industry, but also manage our resources judiciously. These were finite resources, and despite the best of efforts, we had a responsibility to ensure that whatever we provided our caregivers could sustain. It couldn't be provided once and not be available the next week or the week after. And I think that the fact that we actually brought together these individuals into a dedicated group that on a daily basis met to ensure that we were focused on that sustainability, focused on the long term, really, really helped.
Great. Susan, I'm going to let you add on to that if you want. Do you have anything to add?
I think the most important part of success in a situation like this is setting a really clear objective and then setting a very clear objective with the team members. So when we set this up at Bloom, and knowing that there were some people who might be uncomfortable with what we were doing, that was okay. It was a voluntary situation where you could come in, and people who were really passionate about their role came together, and then we delivered something that maybe was a little, was a little uncomfortable for people. It is a medical device, but in the end, a ventilator, and the example I used was from my automotive experience. It's no different. You leave a piece of equipment and you don't take care of it. If you leave your car in the driveway, tires go flat, you lose the key, and the battery doesn't work. And effectively, to me, it's set the goal, get the right people, and then structure the activity in a way that people can understand. So I broke it down to very essential. And basically, that's what we did, is we took the ventilators out of a box. We used all of our operations and lean skills, and we used all of our logistical skills to get them there between us and the state of California. We had people calling us trying to buy these ventilators. We were very clear. These are not our ventilators. They are to be in our building for a very short period of time and go back where the people who do distribute them take them. So once we were able to get people's heads around, this is actually something relatively simple. I mean, I don't want to understate, the complexity, but what I find is especially when you're in a very, very time critical situation, make it simple, make it clear, make sure people understand exactly what needs to be done. And then the speed at which we got things done just kept getting faster and faster and faster. But I think it's that first step of explaining, this is the equivalent. You're going to take the battery out, you're going to charge it, and you're going to put it back in. You're going to test whether the air flows or not. These are all things you do when you build a Bloom box today. There's nothing fundamentally different here, except, the conveyance is very different, but the actual kind of fit, form, and function are very similar to what we do. So I find you've got to put these problems in a language people understand, and the speed at which they will execute is phenomenal.
Yeah, it sounds like you're really trying to meet people where they are, use a common denominator, say, this isn't as foreign to you as you think. You can do this, and
Yes.
just give people the confidence they need to maybe take on something new. And I think, that's a lesson that applies in so many parts of our lives, but especially in a situation like this. Eric, do you want to add to that? What was it like in your shop?
Yeah, happy to. Thank you. So I think what Susan was describing is a clear objective that resonates with me. I was really proud to work at Honda, be part of Honda when we recognized early that the pandemic was real and it needed a response, because our leadership made it very clear that we were going to step forward in a variety of different ways. Of course, today we're talking about the medical supply chain space, but we made efforts to help people with food insecurity. We had lots of virtual volunteerism happening across North America. And then, of course, the responses that I was describing earlier. But there was never a hesitation from those early first moments. And I think with that mandate from our top leadership, it became very simple to move as quickly as we needed to, which I think it was very different for us. It's sometimes difficult to move quickly in the automotive industry. I mean, of course, it's intense competition, but this particular instance felt differentiated. We knew speed was the most important element of this response. So any barriers that we would have had to break through or hurdles we would have had to clear, it felt like we knocked them down and we could just move quickly. And a lot of that happened, kind of manifested in the relationships that we established. You could see it in the teamwork that was happening internally, and also how that we were bridging externally. To me, those were like really the essential, successful parts of the response for us. And it will be some of those areas that we step back and reflect on. How much of that can we adopt or embrace as part of what we look at moving forward, not just in that space, but in our, traditional space?
Definitely. I think that's something that we'll be seeing a lot, is people taking these lessons maybe learned from these experiences and moving them forward. I do want to say I've been on one of Honda's test tracks, and I think you guys have speed down. Was a little horrified, but I feel like it was a safe situation.
I hope it was safe. I'm sure it was safe.
Michelle, I'll let you add your thoughts to that too, if you want.
Yeah.
Maybe not about Honda's test tracks, but about the supply chain.
Well, we know a lot about product testing for sure. It's not as intense, I'm sure, as Honda and some of the other more electric components. But echoing what both Eric and Susan mentioned, truthfully, we couldn't have done any of what we did without volunteerism. When we shut down our factory and sent the women and men that work in our factory, they left the factory as well. And so when we turned off the lights, there was nobody there. And in order to open back up as essential business, wasn't safe in general. We maintained safety within our environment, but it wasn't really a safe place in general to be out in the world. So we found that there was a core group of about 6 or 7 volunteers from the company who would come in and day out. And we referenced the 24/7 mentality. We were still doing our jobs at night and during the day sewing. And it was really the teamwork and the camaraderie that came together because of it. And what everybody was talking about that mission, it really was this total community effort. We had people, when we started getting out the word, not only to our customers and our community, people were calling in from across the country and they wanted to ship us t-shirts so that we could actually put their t-shirts to good use. And so it was an overwhelming outreach from the community of coming together for it. And for Timbuktu, as our company, we are very fast. We kind of joke around sometimes that we're a 30-year-old startup. We're always moving, we're always changing, and we're always adapting. And this one was interesting because as fast as we wanted to adapt, we realized that, we're not speed sewers. So it was actually frustratingly slow in the beginning because we just wanted to get out there and start participating because we were working directly with the city of San Francisco as part of their reopening plan. So the more masks we could get out on the streets, the easier it would be to open up the city again. And so, we always had this timeline and this deadline ahead of us, and it was hard to meet. And we found that it took quite a while to actually get that up and running. And then once we did, it was move.
I have some recently no longer needed Cleveland Indians playoff gear that I might be able to ship your way. It's been a rough end of September there for us, but no, we appreciate that. A lot of you have kind of mentioned, lessons learned throughout all of this, and I think it might be a good time to maybe just kind of talk about what some of those lessons have been and things that you might apply to your business going forward. We've already sort of touched on that, but I think maybe just more directly thinking about, you know, how will our business change going forward from this? And, how will we apply what we've learned? I'm going to send that one over to Susan.
Okay. So from a lessons learned and applied, as I said, we're in Silicon Valley. We're an energy company. We're now a public company, but when I came, we were a startup. So lots of change, lots of innovation. Constant stressing the system and continuous improvement and revolutionary improvement. But one of the interesting things that came from this, and one of the things I probably haven't been clear on, is we did this in California and in Delaware and with multiple states. So the opportunity and the comfort level of us jumping in with the technology we already have today, similar to what we did in California with Sleep Train Arena and the pop-up hospital, and doing this rapid deploy microgrid. We are, as we're sitting here today on this conference call in this panel, Bloom is working with the hospital in Louisiana that was hit by Hurricane Laura. So the ability to rapidly deploy our product, we always knew it and we had done it, but now it's part of our DNA from as soon as we saw that devastation that happened in Louisiana. We got together over the weekend and said, what can we do to help? We have great, Bloom may be, we're not as big as some of the companies that I worked for in my past, but we punch way above our weight. We are very aggressive in making sure that we are connected to people that may have an opportunity to need our product. So we went into that mode of, is there anyone we know in Louisiana who needs help or can connect us with someone who needs help? And we were connected with a hospital. So this is just an ongoing now. This was always a business model we had, but now we are really accelerating the execution of that business model, that rapid deployment. One of the things, as I said, we've always supplied hospitals. So hospitals have to have electricity. So now it's how do we build these relationships with hospitals and healthcare providers like the Cleveland Clinic, and how do we rapidly deploy with other partners quick solutions for energy, and more in a proactive standpoint than a reactive standpoint. But as we sit here today, and there's another hurricane getting ready to hit the Southeast United States. So how do we help those people that need electricity get it quickly, not in months, but rapidly?
So it sounds like you're already applying this, working this through to the future, to other situations, these kind of lessons. So
Yes.
as I turn this over to Michelle, I'm going to add to the question, say lessons learned, but also, how do you apply those lessons and, move forward?
Yeah, so this whole process really taught us just how strong and powerful we can be, and what actually having a manufacturing factory in the city, in the middle of San Francisco, how much power there is within that. We historically, we make bags. And so we've had all of our machines set up to make bags, and all of our operations and workflow goes around that. And what we really started to understand is, as we pivoted towards making masks, that really the possibilities for us are endless. And the beauty of having this factory, and myself personally, I learned how to use a professional sewing machine. It was amazing. And so really, as we're starting to think about what the future of Timbuktu is, one of our core values is to give a damn, which is actually how we kickstarted a lot of this program. And, we're starting to think to ourselves, okay, what are some other sewing machines we can bring in, so we can start doing different materials, and we can start testing more. And, we run the factory Monday through Friday. What happens if we open it up on Saturdays and Sundays and start getting kids in and teaching people how to sew, and what the power of that can be? So really, this whole process has really opened us up to the opportunity that's just bigger than bags, really.
And Eric, do you see this as something, what you've been doing at Honda, is that something that can continue? Do you think that, knowing what you know, like you might try to do other things, or how do you see this moving forward?
Yeah, so thank you. We were very clear on the front end of this that it's not in our interest to step into the medical space. We wanted to do it as quickly and as effectively as we could while there were problems and conditions that required it, but to step back out, which we've largely done at this point. But we've learned in the process. I think we see how we can be speedier at what we do, and we'll try to find ways to apply that to our traditional work. But at the same time, I think we have a kind of a renewed sense that when there is a problem like this, and this time it was a pandemic, it could be something different. We've had other instances in the past where we've responded to floods or hurricanes, things like that. Our company can mobilize and rally, and we won't forget the lessons we learned this time to be able to do that again, unfortunately, next time when we're needed.
Thanks so much. Simrit, I'm going to turn it over to you to kind of wrap this up. And I'm just interested, what lessons has the clinic learned? And, do you think any of these partnerships will last, moving forward?
So the lesson we've learned is that the healthcare supply chain is ripe for reinvention, right? What we've learned is that we are beginning to thrive and understand that we are capable of building a more resilient supply chain for all of us. And each one of these efforts has a part of our answer. Michelle talking about community grassroots levels work, having a local manufacturer in town that can provide that last mile security. Regardless of global efforts, having that last mile security is priceless. For us, it came from our Amish community. Guess who sewed our masks? The Amish. So that level of ingenuity really, really came to our rescue. But at the macro level, we have to begin to understand that we're beginning to vertically integrate into other industries. We need to share information on a more transparent basis. We need to demand plan better. We need to understand these global forces and build for redundancy. We absolutely need to partner to reinvent some of these products. If you think about most of these products, they're disposable. They're a one-time use product that is then thrown away. Think about the waste. Think about the whole economy of one-time use that surrounds itself. And how do we find safe, efficacious ways to protect people in pandemics, but with products that do not require such large operations and mass production to sustain? So I think we are left imagining a world in which there has to be a better way in which a network of partners across industry, providers, and many, many other sectors, including the community, come together to find a way to create greater transparency, resilience, and redundancy in our healthcare supply chain.
Thank you. And I want to thank all of our panelists today, and thank all of you in the audience for joining us on this panel, answering the unconventional innovation call. I think there's been a lot of insight today. We saw how inundated the global supply chain was when this pandemic hit, with everyone demanding the same supplies across the globe. So whereas you could have before, moved to a different geography and looked there for supplies when maybe locally you couldn't get that supply, that wasn't an option this time. So we've seen a lot of different manufacturers kind of rise to the occasion while their own businesses were slow or shut down, and find a way to make all of this work, and find some new innovation. So thank you to all of you. And I hope you can all continue this conversation offline later, or online in a different way later. Thank you.
Thank you.
Thank you, Ginger.
Ginger.
Thank you.